don't have anyone coming in remote, do we?
No, sir.
Okay. Now online?
Yes, sir.
Okay, then I guess I should wait until 2 o'clock to start. Okay.
One more minute.
According to my phone, it's 2 o'clock. Find that the bells on Church Circle are about 2 minutes late. Be on time, but I guess as it goes on, 7 years of listening to them, they're now 2 minutes late. Okay. Well, good afternoon, everyone, and thank you for joining us today for our quarterly meeting of the Interagency Heroin and Opioid Coordinating Council. As you know, last month, the governor lifted the mask mandate in state buildings, and last week, actually, I thought it was before last week, the State House Trust lifted the mask requirements for visitors to the State House. And at this point, nearly all of our school systems, if not all of them, have either planned or have actually lifted their mandates and only are making it optional for students and staff. As everyone knows, this past 2 years has been a challenge, to say the least. But our COVID data here in Maryland has continued to trend in the right direction. Our 7-day positivity rate is below 2%, and hospitalizations have fallen significantly, now below 200. And we're thankful to our citizens for being one of the highest vaccinated states in the country. And we continue to encourage people to get vaccinated. Those who have not gotten their shots to get vaccinated. It's the best way to protect yourself from serious illness and hospitalizations. If you have gotten your initial regimen of shots and are beyond 6 months for the 2-shot regimen and 3 months for the 1-shot regimen, that you get the booster shot as well. Just a little updates on some of the opioid data and legislation in particular. Before we get to our agenda, I want to provide just a quick update on the legislative initiatives that we have to combat the opioid epidemic. Friday, the Senate Bill 394, the Statewide Targeted Overdose Prevention Act, or STOP Act, was announced in the Senate. It was passed, and we're glad to hear that, and it's crossing over to the House for their action pretty much as we speak. And this legislation will close the gap in naloxone availability, requiring certain entities serving people in high risk or at high risk of overdose to develop protocols for dispensing naloxone. High-risk individuals would be individuals who are engaged with our behavioral health system, as well as those who are experiencing homelessness, some individuals coming out of our correctional services and institutions, and those who had recently received emergency treatment for an overdose. And earlier this year, the governor's fiscal year 2023 budget proposals featured historic funding for both mental health services and substance use disorder services, as well as continued funding of the Opioid Operational Command Center. During the pandemic, Unfortunately, we saw overdose deaths increase, and I should say accelerate by about 17%. And that trend seemed to persist in 2021. And our proposed legislation and budgets, we're hopeful that it will help people, not only those who can, or those to survive from the challenges, but to thrive in their everyday life. And so we're taking this hands-on approach to lower the numbers of overdoses and hopefully see these numbers decline in the not-so-distant future. So after those initial comments, I do want to go around the table, just record those who are present. And I understand, and I don't have my guy. I understand there's at least Gary Barton, I believe, is not able to attend today, but otherwise we can go around this table and we'll start with the Secretary Green.
Good afternoon, thank you, Governor. Thank you for, it's nice to see you. Just a couple of quick updates around, we are pleased to be continually evolving from COVID-19, taking the next steps with axing our masking requirements across our system. And again, appreciate all the information that you already noted to everyone. Significant opportunity for us in the Division of Trial Detention Services, as well as the entire Department of Public Safety and Correctional Services. On the 23rd, Wednesday, we'll be taking a significant contract before the Board of Public Works with our substance use treatment operation. It is a significant increase that we have not had in recent years that will allow us to really concentrate our efforts again. And I believe I focused at our last meeting that we are doubling down on this work. We also have a body of research underway right now in our medical unit with Dr. Nimley, looking at how we're dealing with medication-assisted treatment and that transition from jail to prison, longer-term sentence. As we know, within the state of Maryland, individuals can serve a prison sentence 18 months and beyond. Really trying to now what will our future policy and protocol be, and how we recognize that time frame pre-release, and really focus in a very deliberate manner with our new services on instituting MAT for individuals that are going to be returning from the prison environment, not just our pretrial and detention services environment, where an individual is sentenced to a term of confinement up to 18 months. And we know how have a pretty strong focus on what we're going to do there, and we're going to meet the letter of the law to assure that those in our custody in the Baltimore City environment get that treatment. So we're really excited about the future and the coming days as we take that matter before the Board of Public Works and really reimagine our work in this area.
Good afternoon, Reggie Burke from the Maryland State Department of Education, sitting in for State Superintendent Mr. Chaudhary. Couple of updates. Our mental health program that I spoke about, I believe, at our last meeting. We're really doing a good job in getting that rolling out to provide support to our 24 local school systems. And really the support is going to focus around consultation, professional development / training. And a lot of that training is going to come from the Center for School Mental Health out of the University of Maryland. Sharon Hoover has done a lot of work in that area, so she'll be supporting our efforts. And we also want to look at developing a community of practice with expertises throughout the state to provide support to our students in need throughout the state. We also have our teacher training module, which is on a Canvas platform, and it's for our teachers in the state to provide them with extra support in teaching substance abuse prevention to students in elementary and middle and high. Our elementary module is up and running. Our middle and high school module, we still got a couple of tweaks we got to work on. We're trying to make it more accessible for everyone, so we should have that out in the next couple of weeks.
Hi, everyone. Jay Cleary, Chief of Staff for the Department of Juvenile Services. Happy to be here today. Good to see you, Governor. Just a quick update in terms of DJS, similar to public safety. We are still working our way through the COVID-19 pandemic. Thankful that the numbers are coming down. But we certainly devoted a lot of resources to addressing that in our facilities, but we did not stray away from our behavioral health services, which helps with substance use disorder among the youth in our facilities and also in the community as well. The focus for DJS going forward, and this is kind of a milestone for the agency, is that for the first time we are actually spending more money on youth in the community rather than just focused on facility-based work. And that also translates to substance use treatment as well. So what we're trying to do is find ways to address the needs of youth in the community, linking them with substance use therapists, people in the community that can address it, because we find that the success rates tend to be a little bit better when they're in the community, going to school and trying to stabilize their lives in the community. So for that, we're very happy to see that trend going in the right direction. That is an intentional effort on the part of Secretary of Ed to shift towards a community mindset. So we're looking forward to continuing to roll that out and for future success.
Good, thank you.
Good afternoon, Dr. Ted Delbridge, Maryland Institute for Emergency Medical Services Systems, and really working on two things, I suppose. One is to make sure that we have blanketed the state as much as possible with jurisdictions that are participating in our naloxone leave-behind program. So when they rescue a patient who has overdosed and the person has recovered, essentially, naloxone is left behind with either that person or a family member, a bystander. We're actively exploring opportunities to develop resources to take patients to other than a hospital emergency department, a stabilization center or such like that. Hospital emergency departments oftentimes aren't the best resource for the patients we're talking about. And so trying to get them more facilitated access to care.
Very good. Thank you, sir.
And good afternoon, Aaliyah Jones, Deputy Secretary for the Behavioral Health Administration. Thank you for this opportunity, Lieutenant Governor, and thanks for the partnership with everyone who's already spoken, all the work that you all are doing in some way touches work that the Behavioral Health Administration is supporting in one shape or fashion. So I don't think I have anything more to say. You all are telling the story.
Very good. Thank you.
Robin Ricard with the Opioid Operational Command Center, and I'm going to be presenting a lot of data, so I'll go up, and I think Marty Hammond as well. We could just introduce ourselves and we can talk later.
Good afternoon, Major Adam Stursky, on behalf of Colonel Jones of State Police. We continue to work with our federal, state, local partners and communicating with them in partnerships and continue to work cases and interdict the flow of heroin and opioids and eliminate it through Maryland.
Thank you.
And again, Martin Hammond with Governor's Office of Crime Prevention, Youth and Victim Services, sitting in for Yesham Kerman.
Okay, thank you. I guess at this point, we approve the minutes. Did everyone have an opportunity to review them? The minutes from December 15th was the last meeting. Are there any concerns? No concerns? Do we have a motion? Second?
Second.
Thank you. Any objections? Are we all in favor? Say aye.
Aye.
Okay. All right. I'm going to turn it over to Robin Picard. You have a presentation. Thank you.
For that introduction, Lieutenant Governor, and thank you to the members of the Coordinating Council. It's wonderful to see you all in person this time. And this is our first meeting, I believe, of 2022. Today, I'm going to provide an update on the most recent fatal overdose trend data that we have available. This will cover a period through the third calendar quarter of last year. And we will be making the data available on the OOCC's opioid data dashboard and on our website in the coming days. So we're real excited about that. I'm also going to discuss the OOCC's progress in updating the Interagency Opioid Coordination Plan for 2022, which we intend to complete later this month. And once the final draft of the plan is available, we will provide a copy to this council, the IACC, and submit it for public comment. This year's plan is going to be most comprehensive And we're really looking forward to sharing it with everybody. Okay, to begin, the data I'm about to cover was provided by the Vital Statistics Administration. It covers the period between January and September of last year, the most recent information that's currently available. But keep in mind, please, that this is still very preliminary and the numbers they are subject to change. In the first 3 quarters of 2021, there were 2,129 fatal overdoses related to all substances in Maryland. This represents an increase of 2.6% from the same time frame in 2020. And while we are disappointed by the increase, we remain cautiously optimistic about the apparent decrease in the rate of growth in overdose deaths that was observed following the onset of the coronavirus pandemic. And as the Lieutenant Governor mentioned, in 2020, the number of fatal overdoses were around 18% in Maryland and by nearly 30% nationwide. If we look at fatal overdoses by quarter, we can see that the rate of growth in overdose deaths decreased throughout the year. In the first quarter of last year, for example, we saw an increase of 12.2% as compared to the first quarter of 2020. In the second quarter of 2021, there was an increase of 4.5% compared to the second quarter of the prior year. And by the third quarter of 2021, we actually saw a decrease of 8%. This could potentially indicate that we are seeing a reversal of the dramatic increases that we had during the pandemic. However, while we're hopeful, again, I just want to stress that the numbers are preliminary. In particular, the numbers for the third quarter could very likely increase as more outstanding death investigations are confirmed by the Office of the Chief Medical Examiner. And it's also worth stressing that despite this potentially encouraging trend, overdose rates remain at historic highs, and the environment remains very difficult for individuals who might be struggling with substance use disorder. And this continues to be a critical time for Maryland's opioid crisis response efforts, a time that requires, as we keep saying, an all-hands-on-deck approach. Looking at opioids specifically, we saw an increase of 2.1% during the first 9 months of 2021 as compared to the first 9 months of 2020. There were 1,904 opioid-related fatal overdoses during this time, up from 1,865 through the third quarter of last year. Opioids were involved in 89.4% of all overdose deaths during this time frame. Looking at opioids by type, we observed similar trends through the third quarter to what we've seen in recent years. In particular, fentanyl, no surprise, continues to be the main driver of overdose mortality. Through the third quarter of 2021, fentanyl was involved in 83.7% of all fatal overdoses, and there were 1,783 fentanyl-related deaths during this time frame, which is an increase of 3% from 1,731 fentanyl deaths reported the same time in 2020. In contrast, heroin-related overdose deaths continue to decrease. There were 291 heroin-related deaths through the third quarter of 2021, a decrease of 29.7% from the 414 deaths during the first 3 quarters of 2020. And this is a continuation of a trend that we've seen that dates back to 2017, following the rapid increase of fentanyl in the supply of illicit drugs. And then lastly, prescription opioids increased by 3.7% during this time frame. There were 339 fatalities during this time, up from 327 during the third quarter of 2020. Looking at opioid-related fatal overdoses by county, we saw something of a mixed bag during the first 9 months of last year. 13 counties experienced decreases in opioid-related fatal overdoses, while 11 counties reported increases. The largest increase by percentage was observed in Carroll County, which saw a 38.7% more opioid-related fatal overdoses compared to the same time frame of 2020. Other counties that experienced substantial increases by percentage include Dorchester, Harford, and Wacomico. The largest numerical increase was observed in Baltimore City, which experienced 63 more deaths during the first 3 quarters of 2021 as compared to the same time frame in 2020. The largest decreases by percentage were observed in Caroline, Howard, Worcester, Allegheny, Frederick, Calvert, Talbot, and Charles counties. And this map illustrates the data on the table from the previous slide. It shows the percentage change for each county, comparing year-to-date totals through the third quarter or 2020 and 2021. It ranges from red, meaning increase, to blue, meaning decrease. As you can see, the increase in fatal overdoses through the third quarter was not experienced evenly throughout the state. You can also begin to see some clear region trends in some areas, while some other regions experienced some mixed results. Next, looking at opioid-related deaths at a regional level, we saw that the largest increase was observed in Central Maryland. There were 1,329 opioid-related deaths reported in Central Maryland through the third quarter of 2021, a 6.2% increase from the same time frame in 2020. Collectively, the counties in this region accounted for 72.6% of the opioid-related fatal overdoses in the state. Southern Maryland experienced the largest increase by percentage, with 64 regional deaths, or 9.9% more than during the first 9 months of 2020. And the Capital Region saw an increase of 0.8% with 251 opioid-related fatal overdoses. Western Maryland saw the largest decrease in the state, with 101 regional opioid deaths, 15.8% fewer than the same time frame of 2020. And finally, the Eastern Shore experienced 160 regional opioid-related overdose deaths through the third quarter of last year, and that is an 8.6% decrease from the same time frame in 2020. And finally, we saw significant increases and decreases in overdose fatalities related to non-opioids through the third quarter of last year. Cocaine rose by 7.5%. Increasing from 704 during the first 3 quarters of 2020 to 757 during the same time frame last year. There were 413 alcohol-related deaths, 5.7% fewer than during the same time 2020. And lastly, benzodiazepine-related deaths increased by 2.2%. Methamphetamine-related deaths increased by a troubling 50%. And overdose deaths related to PCP decreased by 7.5%. And this concludes my data overview. Again, we'll have this data available on our website in the coming days. And then in the next portion of my presentation, I just want to provide an update on the OOCC's progress in drafting the Interagency Opioid Coordination Plan for 2022.
Hey, Rob,
Yes, sir.
can I ask, is cocaine still the main mixture with fentanyl that we're seeing in terms of fatalities? At one point, it had surpassed heroin. And
I will double check, sir, but I believe it's more heroin. And Dr. Jones, you can correct me if I'm wrong. It's in everything, but.
Yeah, I think that's a really good question. I would say cocaine and alcohol. Alcohol is still obviously pretty common and more greatly used as a substance. So I think it's probably more alcohol than it is cocaine.
that's mixed with fentanyl, that
Yeah.
you're having fentanyl of some sort. And
Well, and if we look at overdose deaths for non-opioids, 80% plus of those are in concert with opioids. So
Right.
there are very few that are completely in absence of opioids overall.
okay,
And the greatest number of that is going to be alcohol.
okay.
Okay, so the Interagency Opioid Coordination Plan, the plan outlines specific goals and strategies to guide Maryland's opioid crisis response efforts. And it's built around Governor Hogan's policy priorities of prevention and education, treatment and recovery, and enforcement and public safety. Every year, the OOCC works with our state and local partners, as well as representatives from the private community-based organizations, to review and update the plan, just based upon evolving needs and priorities around the state. To quickly review some of the information I covered at our last meeting, this year's coordination plan will incorporate several new elements that will help make it even more comprehensive. New considerations in our plan for 2022 will include the findings in our Data-Informed Overdose Risk Mitigation Initiative, or DORM, which was initiated based upon the passage of the Chapter 211 Act of 2018. The goal of DORM is to link data from overdose decedents across various public health and public safety data sources. And linking the data sets enables us to identify common overdose risk factors, which in turn can help us direct resources to the most critical areas and to better calibrate programs and policies that can help us reduce overdose mortality. The plan will also incorporate community feedback collected from our ongoing Maryland Stop Overdose Strategy Regional Town Hall series. We launched Maryland SOS last year in response to the rise in overdose deaths observed during the COVID-19 pandemic. The campaign involved 10 town halls throughout Maryland, which we gathered input directly from communities about how we can do more to help people with substance use disorder. And we heard from hundreds of really passionate and dedicated individuals who provided some really phenomenal and useful feedback. Additionally, the plan will take into consideration the goals of the Statewide Integrated Health Improvement Strategy, or the SIHIS. SIHIS seeks to align statewide efforts across 3 domains with the goal of improving health outcome for Marylanders. Reducing opioid-related mortality was identified as one of the state's priorities under the initiative. And then lastly, the coordination plan will consider the work of Maryland's Racial Disparities in Overdose Task Force. The task force is currently working under the Interagency Opioid Coordination Council to address the increasing disproportionate impacts of the opioid crisis on Maryland's Black communities, which has accelerated in recent years. We began the process of updating the coordination plan last October, beginning with sessions with our state and local partners to evaluate the plan's broader goals. We're now in the final stages of conducting key informant interviews with a wide variety of experts to examine the specific strategies and tactics under each goal, and we aim to have a final draft of the plan prepared by the end of the month. It's coming pretty quick. March is almost here, at the end of March. At which point we will submit it for public comment, and we'll be happy to share a copy of the draft once it's available. Next Monday, on March 28th, the OOCC will host the final event in our Maryland SOS Town Hall series. We started with the Lieutenant Governor, and we're going to end with the Lieutenant Governor. I'm very pleased that you're going to be there, Lieutenant Governor. We're capping off the series with a statewide virtual summit, during which we will review the input that we received at our regional events. We'll also give an opportunity to provide public testimony for anyone who hasn't attended any of the regional events, and we'll unveil the final draft of the coordination plan, and we will distribute information about this event following this meeting, and we sincerely hope that everyone can attend. And before I wrap up, I just want to provide a preview of what you can expect to see in this year's plan. The plan is built around supporting the overarching goal of improving opioid-related morbidity and mortality in Maryland. And under this overarching goal, there are 9 supporting goals, which you can see listed here. Goal 1 is to improve statewide infrastructure for opioid initiatives. This includes supporting interagency and interdepartmental data sharing efforts and using data to inform policy. Such effort is the DORM initiative that I just mentioned earlier. Again, DORM relies on data from a wide variety of partners, and associated data insights will help to better calibrate policies and programs aimed at reducing opioid-related mortality. Another initiative that would fall under this banner are HIDA's Heroin Coordinator Program and the Overdose Notification Pilot Project, which allows CRISP to send notifications regarding non-fatal overdose events to local health officers who can then follow up to those individuals. Goal 2 is to promote youth resiliency. The goal focuses on raising awareness of adverse childhood experiences, or ACEs, which is strongly correlated to substance use disorder. It also focuses on expanding prevention programs in schools. Goal 3 is to increase awareness of substance use disorder. This involves various data-driven public messaging efforts, such as raising awareness about the dangers of fentanyl, Maryland's Good Samaritan law, addressing stigma, how to use naloxone. Goal 4 is promoting naloxone saturation across Maryland. This work is critically important for reducing overdose deaths, as research indicates that distributing naloxone in high-risk areas at a rate of 9 to 20 times the number of fatal overdoses within the community can significantly reduce the risk of fatal overdose. This goal encourages overdose response programs across the state to utilize their approach in naloxone distribution efforts. It also focuses on helping other organizations such as EMS, hospital emergency departments, correctional facilities, and SUD treatment programs to expand targeted naloxone distribution. And Goal 4 also promotes the use of harm reduction vending machines through which individuals who use drugs can access supplies such as naloxone and wound care kits. Goal 5 is to promote comprehensive care coordination. This involves exploring opportunities to expand mobile health clinics, improving long-term intensive case management, and expanding non-coercive harm reduction case management models. Goal 6 focuses on expanding Maryland's crisis response system by identifying and reducing gaps in crisis services, making these services more efficient and promoting the financial stability of these programs. Goal 7, expanding access to evidence-based treatment for opioid use disorder. This involves initiatives such as promoting buprenorphine induction in hospital emergency departments, expanding access to medications for opioid use disorder in incarcerational settings pursuant to the requirements of the Opioid Use Disorder Examination and Treatment Act of 2019, which we will discuss in more depth later in today's meeting, and promoting primary care provider support for individuals with substance use disorder, such as through programs like SBIRT. Goal 8, supporting recovery communities. This involves initiatives such as working with local health departments to embed peer recovery specialists in community settings and increasing certification opportunities for peers. It also involves increasing access to recovery housing and supporting the creation of a network of local community organizations engaged in supporting recovery. And lastly, Goal 9 is to support our law enforcement efforts to dismantle drug trafficking organizations. Each of these goals are critically important, and no one agency, department, jurisdiction, private partner, or community organization can do this work on their own. And as we've learned, it's going to take a lot of us coming together, continuing to come together to address the opioid crisis from all angles. We've seen the success that Maryland's robust response framework in recent years, such as in 2019, when overdose deaths actually decreased annually for the first time since the beginning of the opioid crisis. And we are confident that the priorities outlined in this year's plan will help advance this work even further. And again, we're going to provide and share a copy of the final draft of the coordination plan with the council as soon as it's available, and we would sincerely appreciate any of your input. And that concludes my presentation. And as always, here is our contact information in case you need it. Thank you, sir.
Robin, I think as,
Stay here, sir.
you might as well.
All right.
I mean, unless you're introducing the speakers to talk about the progress that's being made with regard to the Opioid Use Disorder Examination and Treatment Act. So
I'll keep on.
you'll have the floor.
Okay. All right. So to help set up the discussion regarding implementing the requirements of the OUD Examination and Treatment Act of 2019, also known as House Bill 116, I'm going to briefly talk about the OOCC's new grant program that will assist local jurisdictions with implementing the important programs outlined in the legislation. This important legislation requires that all local detention centers across Maryland must implement a wide variety of services for incarcerated individuals with substance use disorder by 2023. This includes services such as screenings for individuals with opioid use disorder and referrals to treatment when appropriate, access to at least one of the FDA-approved medications for opioid use disorder, such as buprenorphine or methadone, treatment for pregnant women with opioid use disorder, on-site peer recovery services, and consultations with individuals upon their release from incarceration to develop re-entry plans. These programs are vitally important because justice-involved individuals with substance use disorder are among the most at risk for overdose, and individuals leaving incarceration without any support are even more at risk. So we're very encouraged by the progress that several jurisdictions that participated in the initial pilot program created by House Bill 116 have made, and we are honored to help expand this programming across the state through our grant program. The OOCC will distribute $8 million to the top scoring proposals that we received. Each grant project proposal can request up to $500,000 to support programs that are required by the legislation. And also today we are announcing a 60-day extension of the deadline for jurisdictions to apply for this opportunity because we know that there's so much going on, especially with COVID. So now we are going to be accepting applications for the grant program through June 21st, and we'll announce our funding decisions on July 1st. The grant program marks the beginning of a new chapter of Maryland's response to the opioid crisis. The $8 million that we are using to fund the program represent the first use of the money of the Maryland's Opioid Restitution Fund. The ORF, or the Opioid Restitution Fund, was established in 2019 to receive any financial settlements with prescription opioid manufacturers and distributors. The ORF requires that any money that Maryland receives be used directly to address the harms of the opioid crisis, such as through expanding access to treatment services and medications for opioid use disorder, which are among our best tools for reducing the risk of overdose. And we can think of no better way to begin using these funds than by expanding resources for one of the most at-risk populations. And with that, I was going to send it over to Secretary Green, but you kind of gave a introduction on your introduction, what you're doing. Is there anything else that you wanted to add?
Yeah, I think you've covered it. Thank you very much. And thank you. I know on behalf of all the locals that I meet with every 2 weeks, they are very pleased of the extension of the grant because there's great interest, and that time will allow them to do so.
Thank you. Okay, and now let's hear from Marty Hammond with the Governor's Office of Crime Prevention, Youth and Victim Services, and then you will hear from Executive Director Tom Carr and Dr. Laura Papard from the Washington-Baltimore HIDA Drug Trafficking Area, or HIDA, about the technical assistance opportunities that they are going to be offering the jurisdictions and have already started offering the jurisdictions who are applying for the grant program. Okay, Marty?
Good afternoon. Thank you very much. The Governor's Office of Crime Prevention, Youth and Victim Services remains committed to the local detention centers throughout the state of Maryland and providing the resources necessary to expand the services for justice-involved individuals. We are fortunate to have partners like the OOCC and HIDA with us. As many of you know, 2/3 of people in jail meet the criteria for drug dependence or abuse as reported by the Bureau of Justice Statistics. As a state partner involved in these important efforts, our office recognizes the opportunity to facilitate a path to recovery for justice-involved individuals throughout the state. We are very proud to announce that we are currently onboarding a correctional service treatment coordinator who will work closely with the OOCC and the HIDA and all the local detention centers involved in expanding treatment and services for the opioid use disorder. The coordinator will focus primarily on expansion of services for justice-involved individuals, a population most risk for overdoses, throughout expanding screening and medication to treatment of the opioid use disorder, MOUD. In addition, the coordinator will enable our office to closely monitor the challenges, needs, and successes of local detention centers as it relates to connecting justice-involved individuals with treatments that they need. This will ensure that the office can identify areas for further expansion and assessment. So, thank you.
Good afternoon, Lieutenant Governor. It's nice to see you again. Members of the council, it's a pleasure to be with you today. For those of you who may not be familiar with the HIDA program, or High Intensity Drug Trafficking Area Program, is a grant program funded out of the Office of National Drug Control Policy, Executive Office of the President. So our HIDA focuses on drug control, drug enforcement, but it also focuses on drug treatment, drug prevention. And we've been funding drug treatment and prevention programs in Maryland for the past 27 years. The Badges for Baseball with Cal Ripken is one prevention program you might be familiar with. We fund those programs in Maryland. At any rate, because other HIDAs starting to get involved in drug prevention, we saw it necessary to create a division for advancing prevention and treatment in our HIDA to provide technical assistance to the other HIDAs, and we're doing that as we speak. We share common goals with you and the UC, obviously, because of the goals of reducing recidivism and reducing overdoses in the substance use disorder population. So it just seemed logical that when the opportunity arose, that we could offer our technical assistance to you. And we have some of the very best doctors around that are experienced in drug prevention matters, experts as well. So I'd like to call up the director of our division, Dr. Laura Papard, to talk to you more about that. Thank you. And I feel necessary to comment. I know the question was asked about what in combination with fentanyl. One of the things you ought to be on the lookout for are counterfeit pills. That has exploded across the country. In Arizona, California, Washington State, Minnesota, and it's coming. It has already come here, so keep your eye on the lookout for that. Laura?
Good afternoon.
Good afternoon.
Having us here today. I want to share with you a little bit about the technical assistance we've been invited to offer, and we're very excited about the opportunity to partner with all of you in helping to make this happen. Tom mentioned that we do have a new division called ADAPT, and that stands for a Division for Advancing Prevention and Treatment. That was funded 2 years ago by the National HIDA Program Office to deliver training and technical assistance to HIDAs across the U.S. There are 33 HIDAs. We've developed an infrastructure for delivering that and have now completed over 67 individual technical assistance requests in this domain across the United States. So we've learned a little bit. We've developed the infrastructure, and last fall, we offered something called a learning community, a very specific type of learning community called an ECHO, to all of the jails, county jails in our region. We opened it up, and we decided that we would, over the course of 8 weeks in this learning community, introduce all of the best practices related to medications for opioid use disorder in county jails. Now, you should know that our mission at ADAPT is to truly integrate evidence-based strategies into HIDA communities. So even integrating one evidence-based strategy, as you know, is difficult. And this is talking about integrating an entire model or a synthesis of evidence-based strategies into a very particular setting. We did conduct that learning community last fall. We did have 2 Maryland jails participate. It was extremely successful, and they were introduced and had peer support and coaching, as well as content expert support in making this happen. But the most important part of that was in talking through, an awareness of what the best strategies are, but then how do you really operationalize them in that particular setting? So it's not an easy thing to do. And I believe that Robin heard through Marty, and there's been a chain of communication that we had delivered this. And so we customized this approach for the OOCC in order to deliver this and support House Bill 116. The way that we've approached that, as you can see here, a flyer, it was an announcement of a 2-pronged approach, and we're nimble. We're used to being nimble with HIDA communities, so we actually are going to adjust that just a little bit based on the 60-day extension. But what we have already done is did 2 webinars and actually transformed the second webinar into a workshop to help all of the county jails that would be applying in developing a successful proposal. And in order to do that, we did cover all of the best practices and different models, ways of thinking about integrating MOUD into county jails. And we did that through partnering with an agency called Health Management Associates. They have successfully worked with California and Michigan and several other states in helping to bring this to life within those states as well. And so what we've done after that is the second prong, which is going to be coming a little bit later. We're going to offer a few more developmental webinars right now up front, because we do want to help them develop feasible and usable models within their jails, but most importantly, based on existing resources. All of them look a little different, as you guys know. All of them have different staffing issues and capacity to develop these programs within their jails. So what we'll be doing moving forward is tailoring this learning community to the needs of the county jails that will be funded. The way that we do this is we've already conducted a readiness assessment. We've had over 10 jails that have completed that readiness assessment. We have shared those results with Robin and with the OSCC team. And so we already have some idea of where they're at in thinking through that implementation and evaluation process. What we'd like to do is, based on those results, we have already started to customize the content that will be delivered in the learning community. But I'll tell you right now, the most important part of the learning community is having them all together, having the content expert available, letting them ask their questions and truly coach each other. It's that peer experience in trying to operationalize this and learn from each other in what's working and what's not within the state of Maryland. So this will last throughout the end of the year. What we'll be doing, we'll summarize those findings for all of you. We will send those to the OOCC and we'll be in frequent communication with Robin. We have a communication plan established, but the primary goal is to really increase awareness for all of you and where they're at in operationalizing this very important bill. And it does take time and it will take a sophisticated approach, but they will have that support through this initial layer of technical assistance and will be available as needed to help bring that to life for them in their communities. Thank you.
Good, thank you. Any questions about taking place at IDA and the date on the Opioid Use Disorder Examination Treatment Act? It's a mouthful.
And if I can just make a comment,
Yeah.
Lieutenant Governor, all of the wardens and deputy wardens are so want to implement this. It's a huge undertaking, and just we value the partnership that we've formed with GoCap and HIDA and corrections. Really excited to get this moving forward faster.
I can say back in 2014, when the governor and I were first running for office, and when we met with local officials, and particularly meeting with the local sheriffs who, in most cases, manage the jails, the local jails, they were the ones that really brought the attention to the whole heroin issue, the opioid issue. But they were the ones that were saying, you know, when we would ask, what is the biggest challenge that you're facing? We're expecting to hear, you know, equipment, radios, vehicles, you know, things of that nature. And it was almost to a sheriff, it was heroin. It didn't matter if they were in Dorchester County or in Frederick County. That was the issue. And they were saying our jails are filled with these folks who are not really violent, but they do dumb stuff because of their addiction. They're trying to get money for their addiction, and they are, you know, stealing or whatever the case may be. And we're seeing them kind of rotate through, and, you know, they're taking up space that the more dangerous people should be in. So that was kind of the first place we were really hearing it. Any other comments generally? Welcome, Nation.
Yeah. I was going to say that I had a meeting a couple of months ago with Chris Welsh, who some of you probably know, from the University of Maryland, who does work in the space around treating people who have opioid use disorders in jail settings. And they've done some research in looking at some of the attitudinal barriers that interfere with people either getting referred for medication-assisted treatment. And I think that if you haven't spoken to him, I think I want to connect him with you all, because I think that he could give you some useful insights from what they found in their research as you look at how do you help change some of the attitudes of the folks who are really working on the front lines, you know, with the individuals who are incarcerated. That might be very, very useful for you.
If I may, Lieutenant Governor, and very much enjoyed your presentation. One of the things I think that we've discussed in jails, local jails, which obviously we run the city jail, is this idea of space and how we can be nimble. And something that has occurred as an outcome of COVID, and we've incorporated it into some of our future contracts, is how can we're very nimble now in a virtual manner, not just with staff, but with the population with who we are responsible to. And I know many of my local colleagues, as well as our own department, have become more nimble in the rollout of that, virtual kind of aftercare, that virtual follow-up treatment, that virtual engagement, both inside and outside the facility. I'd be interested to hear if there is a best practice that is beginning to evolve around that particular piece, because I think it's a great opportunity for us to create this omnipresence, if you will, of connecting people that are in treatment within our facilities and external, and how do we model that? So I'd be interested to know if that exists.
Shall I respond to them?
You can speak from there.
Okay. We actually fund the Fairfax County Jail, as well as we will be funding, starting in 2023, I've just recently decided to make that award, the Baltimore Detention Center, specifically related to community reentry programs that you're describing. And so there are best practices for community reentry, and happy to share some of those with you, but it really is that linkage to care component, but it's also the wraparound and comprehensive service delivery, maintaining the frequent communication pathways, getting the cell phone established for that follow-up piece as well. The peer recovery specialist, a lot of evidence around utilizing and fully integrating peer recovery specialists into the community reentry package. So I do have several models. I'm happy to speak with you later as well. And we're also happy to do a formal literature review for you and provide a synthesis of that literature. We do that frequently for other HIDAs across the U.S. to give you a summary of best practices, specifically in that space.
I think that would be very interesting, because a number of our counties and our facilities as well are looking at tablet programs, and not just those that need to be interactive, internal, external, but how you operate that inside your system to have that continual support, that continual rollout of information and communication. I think that would be very beneficial and perhaps an opportunity post-COVID, something that we've learned to do, which is be very nimble in that virtual environment. I would like to talk more about that. Thank you.
Speaking of that handoff between the individual who's incarcerated and then returning to the street or returning to, the community, I believe in the board agenda this week is the therapeutic detention center. And, that the idea about the jail in Baltimore and what you do with it and how, and, the governor closed the old 18th century version of it a couple of, several years ago, but then the conversation became 60% or more of the population, and not just there, but in most of the correctional facilities, are suffering from substance use or mental health issues or both. And so in terms of designing a new jail, the thought process was something that's more in tune to treating that 60% of that population that's coming into the facility. And so that is something that we'll see in the coming years. I think this is the design that's coming before the board, but in the coming years to see that transition to help those folks who are going to return to the community. And then we'll really need that handoff once they walk out the doors, and that follow-up to make sure that they are receiving continuing to receive treatment as they go forward. I think often, and probably part of it's stigma and the fact that, substances are illegal, is that sometimes for the community, and I just mean generally, citizens don't think of the recovery process for opioid use disorder in the same way that they think about the recovery process of alcoholism. The alcoholic will tell you every day that they're sober, and they can count how many days since they had their drink. They can pinpoint a date of 5, 7, 20 years ago to the date that they, became they moved away from alcohol. And I think that often, and this largely anecdotal, and you probably hear it from families, where they'll say, well, my son or daughter or my husband has gone through treatment 5, 6, 7 times, and they still have a problem. And it's because they haven't reached that point where they're looking at it that this is an everyday issue. It's not just, I can go through treatment and I'm done. It's that I have to fight this struggle every day, just like the person who alcohol is their issue. Now, there's probably more scientific side to it, but just, looking at the outside, that person who gets past their alcoholism is doing it every day. And it seems like it's something similar for opioids. And probably people who are addicted to Coca-Cola also. Joe over there, sorry. No stigma, no stigma. All right, anything else that anyone wants to mention? We will let everyone know the date of the next meeting. We don't have it scheduled as yet, but we meet quarterly, so in another 3 months, we will be gathering around. We will have good news in terms of progress on our reports, as well as continue to see progress getting through the pandemic. I want to say thank you to everyone. Thank you to those who spoke here today. Thank you to Haida for what you all do every day. And so with that, I guess we're at the end. That's the recess bell going on. That's how it sounded when I was in elementary.